Okay, fantastic. You're gonna hear me talk while I do everything, just so you know. Okay, so we actually have Sheila here on the table. She's coming in because she has right shoulder pain. I've actually worked with her a couple times in the past. It's been a little while now. Yeah, it's been a little while now. Sometimes in the past has been from some more extreme sports like boxing.
That's okay.
Yep.
That's right.
So I just kind of want to run you through it. Hopefully you can see me on this side of her. I'm a little bit far from you, but hopefully you can see it. What we're going to do, because you'll see me actually do it on both sides of the shoulder. I'm going to run through the muscles on this side, this being the shoulder of pain and complaint, and then I'm going to run through on that side actually as a comparison, and that might be a little bit more visible. Push down with the wrist. So again, I'm looking for whatever muscle she cannot activate. Activation is kind of complete contraction. It will actually lock into place, elbow into your side. Okay, so the lat's doing good, but the subscap is not. Like that, push out to the side. Super smooth is doing good. Just like this, wrist out towards me. Teres minor, not so good. Push back with the wrist. First phase seems to be okay. Push back to the wall behind you. Upper trap. Not so good. Just like this. Push across towards the shoulder. Good. Push down to this hip. Good. So good. Subscap, teres minor, inverse medius. Cool. You're going to kind of see me run through that on this side. Again, that might be a little bit more visible. I'll try to step out of the way. Push down. That subscap is good. Push out towards me. That wrist. Teres minor is okay on this side. Push back to the wall. Upper trap is good. Push across to the shoulder. That's good. Down here. That's good. Push down with the wrist. Good. Straight push out to the side. Cool. So when you really do that side to side, you get a lot better comparison, so then it becomes even more evident which of the shoulder muscles we're actually dealing with here. So first one we're going to go after is actually that subscap. It plays a crucial role in any injury of the shoulder. Push down. Perfect. So we're going to get on that attachment point of that muscle. Just hold it for a minute to kind of get it to release. So the subscapularis plays a crucial role in the shoulder as it is the stabilizing muscle of the shoulder. So with each action or movement of the shoulder, it actually draws the head of the humerus back into the shoulder and make sure it stabilizes that way. If it is not activating right, it allows the shoulder to slide, even if it's just slightly out or away from the body in those movements, and that will be actually what most often actually causes injury to the shoulder. Not the only reason, but pretty common. So what I didn't say earlier is that, so while sometimes I'll show like range of motion, just to show where it is. She has full range of motion in the shoulder, it's just painful to do it. Is there anything in particular you're having a hard time doing because of that pain?
I know there's at the gym, the overhead pull down function that hurts.
Okay.
The row, I cannot do a row.
Can't do a row.
Cannot do a row.
Okay. Cool, so overhead pull down and row. So overhead pull down, we actually saw what we call the upper trap muscle was not activating or inhibited. Upper trap runs from the base of the neck to the top of the shoulder. It is one of the crucial muscles in that particular action. The traps in general are a crucial part of that action, and the rows is actually back to the subscap, and we're saying teres minor. So while subscap pulls the shoulder in, its other function is to actually create internal rotation of the shoulder. So when she's actually going back into that row, she's feeling it. Push down. Good. So I'm seeing that working. Check it. See if we can adjust it. Push down. Good. So we are going to adjust that shoulder there. Right. Slide from it. Push down. Good. You computer, can I feel that, right? Push down,
Can I feel it?
like it, yeah,
Yes.
activating.
Yeah.
Really spin on the whole, push out away from you, towards me, with that wrist. Teres minor. Do that again. Good. And again. Yeah, it's the part that hurts. She's doing a great job of not screaming on me.
Yeah.
I promised I'd mute the screams if it comes about. Yeah, not screaming yet.
Not yet.
So what we're actually looking for is where that muscle attaches, where the tendon attaches to the bone structure, and that's actually what you are just getting on there, rubbing it out in order to activate it. Push out towards me. Fantastic. One of the cool things about pushing in these muscle tests even is actually the test itself will let you know almost ahead of time if it's inhibited or not. I'm not sure whether you can see that. But whether or not the shoulder will actually roll into place. So we should be able to get a full kind of 90 degrees rotation there of the shoulder. So when I actually go to test that subscapularis, you put them into this position. If they're falling short of that, they're getting stuck here, like actually immediately know it's going to be inhibited. You're not going to have the strength behind it. So even just a simple activation, and you'll find, like in this case where we're actually getting teres minor, which just comes out, she went from about there, and then after it, she was able to actually fall into that position. Push out again. And that's how you'll know you're actually getting it. Right there, push back to the wall. So now we're looking at the last of the three muscles, which is upper trap. Push again. Again, we're looking at where it starts, where the muscle ends, push back, where the muscle ends. Which the upper trap actually inserts at the top of the scapula there, which is a really, really common muscle for anyone that gets like stress in their shoulders. Most people even say, hey, I feel like my shoulders get pulled up. That is, for the most part, that upper trap muscle. You have a little bit of what we call levator scap in there too. But all those knots we'll describe across the shoulders as an upper trap. Interesting enough, very stress related, very stress sensitive. The reason being, which I actually haven't gone into this in any of the other videos, but actually the reason being for that one is every muscle has a particular nerve that innervates it, the nerve coming off of the spinal cord. The nerve levels correlate with the different levels of the spine or the vertebrae, so usually it's like the C3 nerve, C4 nerve, C5 nerve. C5, 6, 7 is down in the arms, so the arm muscles. Upper trap is actually unique because it is actually innervated in part by one of the cranial nerves, which the cranial nerves actually come from the brainstem and not the spinal cord. And so it actually has a lot to do with what we call parasympathetic or sympathetic connection. There's a much more direct response, and so it actually is more tied into the stress, actual stress response in the body.
So I'm stressed.
So you're stressed. It's always a part of it. Always a part of it. We can't win on that one. Push back. Push back in. Again. So we're going to look at those same structures when we look at the prospect of adjusting. Again, with this, I'm looking at shoulder, I'm looking at occiput area, or the base of the skull. Turn your head that way for me. Push back. Cool. Turn your head the other way. Push back. Again, looking at muscle activation, we're able to figure out pretty easily which direction we need to actually adjust it. That's one question I do get from people. As for the most part, my assessment of adjusting comes from muscle testing and not from X-ray analysis, and that's actually how we do it. Push back. Okay. Cool. Turn it that way this time. Push back. she even asked me, actually before we started, was, hey, I do have a shoulder thing, because that's kind of what I was looking for today to make a video for. She said, I also am having some issues with my neck. Will you be adjusting that too? To which I responded, probably so, because in trying to fix any kind of shoulder issue, it almost always leads back to the neck. Not only do multiple muscles actually connect between the shoulder and the neck, but then you're also looking at for that nerve innervation component of the nerves that actually activate the muscles of the shoulder and the arm come from the neck itself. So you have a couple things that connect it back in, which means it does have to actually be assessed when looking at a shoulder problem. And there we go, this is actually letting me. Push back. Fantastic. Push out towards me. Good. And push down again. I always like to go back and make sure, push down again, that after we've done other work, everything's still holding okay, push down. Because in this case, for example, subscap, we got one more release point here.
You found it.
Found it.
You found it.
Yeah. Push down. There. Cool. So actually, I'm going to have you sit up just for a second. Let me see how it feels moving through that shoulder. Just moving it.
Move it around.
Yeah. Maybe sit some of
Yeah.
that overhead stuff.
Yeah.
Yeah.
Yeah. That's usually the trick right here.
Right there. Going back.
Yeah.
Cool.
Very good.
So we will actually send her back into the gym. She will do her rows, she'll do her overheads, and we'll actually see how it responds that way because we want to make sure she can handle that pressure load and it not create pain. Cool.